Hi all, I'm Dr. Neema Bhat, Senior Consultant, Hematology, Hemato-Oncology, Bone Marrow Transplant and Pediatric Oncologist. I'd like to talk to you about a topic called aplastic anemia. This is probably something that most of you are not familiar with. So to break it down into simpler terms, aplastic anemia is nothing but the failure to work of the factory that makes blood cells called bone marrow. So we have an organ systems, we have heart, we have liver, we have intestines. Just like that, we have a factory or we have a system that makes blood cells. This system is called the bone marrow. When patients have failure or this organ called bone marrow stops working adequately, it causes patients to have low blood counts. So there are mainly three types of cells: red blood cells, white blood cells and platelets. So when we see patients with aplastic anemia, they present with what we call pancytopenia, which is low hemoglobin, low WBC counts as well as low platelets. Now these patients have to be evaluated in the right way, making sure that the low counts is because of aplastic anemia, which is failure of the bone marrow, and not really because of a type of blood cancer like leukemia or lymphoma or some other blood cancer. After ruling out or differentiating between the right types or arriving at the right diagnosis, these patients need to be taken on to the next step, which is the treatment. So what is the treatment for someone who's had bone marrow failure or aplastic anemia? It depends on a lot of parameters. Depends on how old the patient is, how severe their counts, severely low their counts are, and how fit are they to tolerate high-end procedures versus just going on medications. So if we broadly divide it into two categories, adults and pediatric patients. Adult patients who are above the age of 20 but below the age of 40 to 45 would qualify for what is called a bone marrow transplantation. Adult patients who are above the age of 40, if they have a fully matched donor with one of their family members, would still qualify for bone marrow transplantation, provided that their organ functions are in good condition and they are physically fit enough to be able to tolerate a bone marrow transplant. Now, if they are older patients, consider the patient is older than 50 or 55 years of age, most often, most of the organs will start sort of seeing a depletion in their functioning or fitness. And these patients can no longer tolerate bone marrow transplantation and they would have to undergo what we call immunosuppressive therapy. So in aplastic anemia patients, some part of the immune system would have taken over the bone marrow and doesn't let it function or work and makes it fail. So when we put patients on immunosuppressive therapy, we give them a particular antibody or protein called ATG in combination with cyclosporin. So it's a combination of 3 to 4 medications in addition to antibiotics, antivirals, antifungals, so that they don't end up with major infections. And with the help of these immunosuppressive medications, we alter their immune system so that the bone marrow is restored to as close as normal as before the diagnosis was made. What happens if the patients are younger? So if your patients are younger than 20 years of age, which is our pediatric population, most of these patients have to go on for at least another 30, 40 years to lead a full life. So we are looking for what we call a long-term cure for aplastic anemia, not just a control which would only last for say about 5 to 8 years. So the cure for aplastic anemia is again a procedure called bone marrow transplantation, which we try to look for the donor first within the family members. The first degree members of the family are subjected to what we call high resolution HLA typing. If we find a full match for HLA typing, then we select that particular donor and evaluate them for the absence of, so they should not have the same disease for which they are donating bone marrow. After doing that, the patient is admitted to a bone marrow transplantation unit. After doing all the due diligence, making sure that the patient or child does not have any major infections, the patient undergoes the procedure called bone marrow transplant. During this procedure, the patient will have low WBC counts, low platelets, because of which they have to be monitored aggressively and under very close supervision, making sure that they also get blood products as needed, they get antibiotics, they are monitored for fevers and infections, and after this rigorous journey of approximately 2.5 to 3 weeks, they are able to be discharged from the unit, usually in a healthy condition with almost normal counts. After bone marrow transplantation, a patient should stay in follow-up regularly with their transplant doctor so that the transplant outcomes can be maximized to the best for few years to come. So aplastic anemia in a nutshell is a disease where the bone marrow fails completely, where all the blood counts go down, and the only way to cure this is by doing a BMT or bone marrow transplantation, which has to be done in a highly specialized center. If you have any doubts regarding aplastic anemia or the role of bone marrow transplant or other treatment modalities in aplastic anemia, kindly feel free to reach out to us at Apollo Hospitals, Bangalore. Thank you.